Well, let's go back to Leanne with Dr. Brownrigg.
And Lorraine, Michael, and Lorraine is our willing candidate. Peter Brownrigg's never looking for volunteers, but Lorraine, what was it that you wanted to see change? What is it that...
Well, I was looking at myself in the mirror and I was doing this like this all the time. And when I saw Dr. Brownrigg, he said that I wasn't ready for a facelift.
I'd say
so
not.
he proposed to just kind of fill
Just give you a little more volume and reinflate things.
And we're doing that live. So I don't know, do I have to warn people, or is it so subtle that people, yes. So if you do not like needles, avert your eyes for a few seconds,
And we'll get
but you
started.
will be able to see the transformation. So you talk us through this.
So what we're going to do is we need a way to get in. This is a blunt cannula. So we use blunt cannulas these days. Little pinch, Lorraine. I need a little way to get it in, and that's given me a spot to get in. I'll put that there.
I'm a really lousy assistant nurse, I have to tell you. Yeah, when you back away from the patient, it's never a good sign. We actually did a show with you years ago. I think there's an interesting story of how you were one of the first people, or it's debatable, to bring Botox to Ottawa. You talked to another surgeon about that, but when you first heard about Botox, you thought this...
I thought it was crazy. And no one's going to do that. That was nuts.
You were talking to surgeons in New York, and they were all talking about it, and the reaction you had.
2 years later, I'm down working with them in New York, and then we came back, and I think we did it on CTV News some 15 years ago. So this is going in.
I don't think I've gotten any better about it, though, have I? I will never, ever volunteer to work in an OR. There.
We just need to find our way back.
So we will be able to actually, in the next minute or so, apparently
I don't feel
see
anything.
I know you don't.
That was my question.
No, I don't feel anything. It's like numb.
So there's no freezing?
There's freezing built into the filler. Now this one is called Voluma, and it's for one that you place quite deep to give maximum amount of lift to the tissues, as opposed to other ones that will be much more superficial. At first we had different materials, but they continue to improve, and their longevity improves. So what we're doing here now is just adding volume on top of Lorraine's cheekbone area here to lift this up, and the cannula is just sort of tunneling through, pushing nerves and vessels aside so that we're not cutting into anything.
What is the filler, actually? What is the substance?
It's hyaluronic acid. It's best to describe it as sort of a sugar molecule that's in every life form.
And does it react the same in everybody's body?
I have never seen anyone allergic to it.
Okay.
Now, we've put in about a cc of filler there.
And you always say less is more.
Absolutely. It's always easy to add more if you feel like you need it. You don't want to be trying to take it away.
And we have about a minute left. I can't say that we've ever done anything like this.
And there we go.
On this tight a deadline.
And Lorraine, did it hurt?
I only first felt the first needle, and then all the rest, nothing at all.
Okay.
And you can see
I can't
we've
see, so we're
gone
going to turn
in.
around a little bit.
We've given her more volume in through here, which has lifted that area up. We'll go in after and we'll add fill down in this area complemented up here, and then a tiny bit through here.
And what is it that you most like about this?
It looks natural. There usually is little to no bruising and bleeding. I'd love to say I never had a bruise, but you never can promise that. But you can see that this is much more comfortable. Previously, we had sharp needles, and you would cut through nerves and vessels, and they would bruise a lot. And especially this area through here or down here, there's a lot of vessels, and people would come back, and they were very unhappy. They liked the look, but it took 2 weeks for the bruises to go.
So this takes how long? You can just go back to work?
She can go back to work.
And it doesn't feel numb. It doesn't feel numb.
This should last up to, well over a year, possibly 2.
Okay, well, you know what to ask Dr. Brownrigg for next
Christmas.
Christmas as well, Lorraine. Thank you for joining us. Michael, I know, is really looking at the monitor.